who have joined us for this very important initiative. They're from Michigan, Maryland, Maine, Colorado, New Hampshire, New York, Ohio, and they've flown in today in order to push for universal health care in our country. We are here today to introduce the state-based Universal Health Care Act. And that bill will give states the support and flexibility to create universal health care in their state. I introduced this legislation for the first time last year after private equity tore through the Steward healthcare system, shuttering 2 hospitals in my state and pushing 31 hospitals across the country into financial disaster. It was a cynical sellout of our healthcare system to line the pockets of private equity investors, an example of why our healthcare system is broken in the United States. A healthcare system doesn't sell out public health for corporate wealth. That is a sick care system. A sick care system that is too complicated, too expensive, and is not what the American people deserve. The solution is to treat healthcare like the public good which it is. Invest public dollars, make it available to everyone, everywhere in this country, when and where they need it. The state leaders standing with me across the country are prepared to innovate and expand access to care. They are working to build a system to lower the cost of care, cut down wait times for appointments, and cut through the red tape. And that is why we need to pass the state-based Universal Health Care Act to support their work and move us closer to the reality of Medicare for all. The fight will be hard. The system was already broken, and Republicans and Donald Trump just made the biggest cuts to health care in United States history. They cut over $1 trillion in health care. Medicaid, cut. Medicare, cut. The Affordable Care Act, effectively repealed. 17 million people could lose their health insurance. More hospitals will be taking more uninsured patients, which means they lose money to pay workers and care for patients. Nursing homes might close or take fewer patients, leaving seniors sitting in hospitals waiting longer for somewhere to go. Community health centers and Planned Parenthood clinics might have to cut services, leaving sick people to get even sicker before receiving any care. Donald Trump and Republicans have forced these health providers to look at cutting back services or closing altogether. Some will feel forced to invite an invidious corporate funder to keep their doors open. The state leaders here know the cost of these cuts. To guarantee people have care, they will have to dig into their budgets and make difficult cuts knowing people's lives are on the line. We have time to fight these cuts. Many of them don't take effect until 2026 or 2027 or 2028. And we will fight them every single day until then. And we will be proposing the solutions to the problem. We need to fight for a system that can't be rated by billionaires, that doesn't charge too much for too little, leave people in debt, burn out health providers, and not provide the high quality, unlimited care that people do deserve. Healthcare is a right, and we need universal health care. We need Medicare for all, and we need the state-based Universal Health Care Act. So I have been partnering over the years on this issue with some of our nation's great leaders. They are here with us today. Congresswoman Pramila Jayapal is here. But my partner today and the co-sponsor of this bill, the lead co-sponsor in the House of Representatives, is our great leader who insistently and persistently and consistently fights to ensure that there is access to health care that is affordable for every American. My friend, Congressman Ro Khanna.
Thank you. Thank you so much, Senator Markey. Senator Markey always says things in such a simple way and is one of the greatest progressive leaders in our country. He always was a great progressive leader, but then when he had the Markey verse, he just became a sensation, so much so that my interns all wanted to get pictures with him. All the young people looked to him for his leadership, and he was one of my first mentors in politics well before I was in Congress. And I'm honored to be here with Pramila Jayapal, who really was the brainchild behind this bill. She has so many bills, the Medicare for All bill, free public college bill, that she said, Ro, just can you take this one bill? Because I'm doing everything else for the Progressive Caucus and cause. So I appreciate, Pramila, your being here. And I'm so honored that we have incredible state leaders flying in from Colorado, from Ohio, from New Hampshire, flying in for this, because they're the ones on the ground doing the hard work in seeing a single payer system in their states. And just like in Canada, to get to single payer, it started in Saskatchewan, a province in Canada. Similarly, they believe that by showing their leadership in these states, that will eventually get us to Medicare for all. I don't want to speak long, but I think the contrast is very simple. While the Republicans are fighting to take health care away from people with over $1 trillion in cuts, Democrats must be the party that stands for Medicare for all, guaranteeing everyone health care in this country. It's not just a moral issue, it's an economic issue. You see, if you care about creating jobs in our economy, the average business has to pay $25,000 on health care costs just to hire someone. Now, we're talking about the age of AI and robots. Imagine what you're going to do as a business. You can hire the robot, or you got to pay $25,000 to hire a person with health care. It's actually leading to the automation of jobs. It's leading to the outsourcing of jobs. It's the reason Americans haven't gotten a pay raise for 30, 40 years. All the money is being sucked out by insurance companies. If we had Medicare for all, we would actually bring manufacturing back to this country. We would actually have a raise for working families. We would actually have businesses that are able to create and hire more people. And by the way, it would be the single best thing we could do to lower our deficits. Because who's ripping off the American people? The pharmacy benefit managers that are charging billions of dollars to our taxpayers. The hospitals that are charging facility fees to our taxpayers. Medicare Advantage that is basically telling people that they're sicker than they actually are, ripping us off. Medicare for all is the moral thing to do, and it is the economic thing to do. It means higher wages, lower deficits, and more jobs in the United States. And these leaders are making that happen and that possible. So I am so grateful to all of them. And I am grateful now to introduce the former chair of the Progressive Caucus and the person who really came up with this bill initially and did all of the legwork, my friend and colleague, Representative Jayapal.
Thank you so much, Representative Khanna, for your amazing leadership on this and so many other issues, and for connecting all of the things that we're talking about, from the loss of health care to automation to the loss of jobs. Senator Markey, you are always on the front lines of all of our progressive issues, and I am so grateful to you for your leadership, for your stewarding of these incredibly important issues. And to all of the state leaders here, it makes me so excited to see you, because when I do the Medicare for All conferences, you are the ones in the room. You are the ones continuing to push on the front lines to build the coalition that we need to build. And we are gathered here today because it's no secret that in the United States of America, the richest country in the world, we have a for-profit healthcare system that puts patients last, not first. In the richest country in the world, it's criminal that 85 million people are uninsured or underinsured. It's criminal that 100 million Americans have medical debt that totals $200 billion with a B, dollars. It is criminal that even as more and more Americans suffer and die because they can't get health care that they need, the 5 largest private insurance companies had $371 billion in profits over the last decade, all by denying claims and by raising prices for essential care. And what's most criminal of all is that after seeing all of that, What do Republicans do? What Representative Khanna, what Senator Markey both talked about is they decided to pass and sign a bill that kicks 17 million Americans off of their health care, all so that billionaires can get a giant tax break. So if they're successful, we have Americans that are sicker and poorer. If we are successful, we have a country that actually values the health care of every single person in America from birth to death. I always say that we've never suffered from scarcity in America. We suffer from greed. And there's really no other issue that showcases that as beautifully and terribly as this one. So today I'm really proud to stand with my colleagues, activists, and organizers as we reintroduce the State-Based Universal Health Care Act. Roe is generous in giving me the credit, but actually it was my predecessor, Representative Jim McDermott, who was a physician in the House of Representatives, that first introduced this bill because he felt like at the same time that we were pushing for Medicare at the federal level, we needed to have a way for states to access the federal dollars, the stream of dollars for healthcare, so that we could create our own state-based universal healthcare programs. So this bill does exactly that. It gives states access to federal funding, to the necessary resources to build out these plans. It allows all of these state legislators to have the dollars that they need to support universal health care and show us how it's done. We can do this at the state level. We can do this at the federal level. I'm going to keep pushing for Medicare for All. That is, I'm so proud to lead that bill with Congresswoman Debbie Dingell, with so many of the partners that are here today. Everyone is a part of the Medicare for All movement, but we need to pursue it at both the state level and the federal level. There's recent polling. I mean, the polling has been clear on this issue for so long. But if you want to get the most recent polling, over 60% of Americans support a universal health care system. It's not just good policy. It's not just good economics. It's actually really, really popular. And it's not a radical idea. Anyone who wants to paint this group of legislators as naive or idealistic just needs to go to any other country in the world that is as rich as the United States of America, and you see that you have a healthcare system that isn't dependent on your job, isn't dependent on when you sign up, doesn't have all these different pieces that allow private insurance companies, private drug companies, all of these private entities that benefit from being able to take over the system. That's what we're driving here today for, and we can do that by both passing the State-Based Universal Health Care Act and, of course, by continuing to push for and pass the Medicare for All Act. So thank you all so much for your work and advocacy. I have here that, is Joe Neguse here? Nope. Okay, so I will introduce, my good friend, Michigan State Representative Carrie Reingans, who's been doing so much work in her home state of Michigan.
Thank you so much. Thank you. Well, I'm state representative from Michigan, Carrie Reingans, and I believe that healthcare is a human right. With the richest country in the world, 100 million Americans having medical debt, that is just wrong. I am here today to support the State-Based Universal Health Care Act because as a state legislator, I have actually introduced a state-level bill in Michigan called MyCare, and it actually needs federal approval. We will need federal approval to use federal dollars and get waiver authorities in order to implement our bill at statewide in the state of Michigan. In light of the reckless and irresponsible cuts in the big bullshit bill that was passed just days ago here in Washington, D.C., I do believe our healthcare system will collapse in the next couple years. This will happen because hospitals and nursing homes will close. Millions and millions of people will be losing their healthcare coverage across the country. There's a tax on student loans, which means people won't be choosing medical fields to go into to study, and we'll lose healthcare providers. And even if you have coverage, you're going to be paying more and more, and that's going to price a lot of people and a lot of employers out of covering their employees. So our job as leaders is to be ready with a new way forward when the healthcare system collapses. And I believe that way is through a universal healthcare system with a single public payer, be it at the state level or the federal level. This is a kind of state-federal competition. I want us all to win. So we are here today to make sure that we can ensure the freedom for Americans to choose to change jobs without worrying about losing their coverage. The freedom to start a new business. Isn't that the American way? With Medicare for All, we'll be able to get more care for less cost, and it'll be easier for the patients. And that's who really should be what we're thinking of nonstop. So we're here today rolling up our sleeves and fanning ourselves in the heat because we need to be ready to start over when we have the opportunity to start over, which I think is not too far off. So it's our job to be here fighting for Medicare for All, fighting for the patients all across our country. So thank you so much, Senator Markey and Congressman Khanna and Congresswoman Jayapal, for starting this work and helping us in the states. It's really an honor to be here today. Next up, I'd like to introduce one of my fellow state legislators, Maryland Delegate Sheila Ruth.
Good morning. I'm Maryland State Delegate Sheila Ruth. Even before Republicans in Congress passed the so-called Big Beautiful Bill, our healthcare system was already flawed. Too many people die because they lack insurance or because their insurance company put profits over care. Too many people are trapped in medical debt because of unaffordable medical bills. But now President Trump's bill, which is anything but beautiful, is going to rip healthcare away from millions of Americans to give tax breaks to billionaires. We will all suffer as costs go up and hospitals close, making it harder for all of us to get care. If the federal government won't live up to its moral and economic imperative to guarantee health care as a human right, it should get out of the way and let the states do it. This bill will remove barriers and give states the flexibility to design a health care system that works best for their state. I want to thank Representative Khanna and Senator Markey and also Representative Jayapal for their work on this and for this bill. And I call on Congress to pass it so that we can finally put people over profit and ensure everyone can access health care when and where they need it. And now I'd like to introduce Maine State Senator Rachel Talbot Ross, Speaker Emeritus.
Thank you so very much. I want to start off by thanking Representative Khanna, Senator Markey, Representative Jayapal. Special thanks to the Maryland State Delegate Ruth for introducing me, and additional thanks to our Michigan State Representative Carrie Reingans for all of her work. We are standing here together this morning. I want to thank them for their leadership, their vision, and the commitment to passing a state-based Universal Health Care Act. I also want to take a moment just to acknowledge the unwavering support of Maine Congresswoman Shelley Pingree, who is a co-sponsor of the act and has been so since the first introduction of this legislation. So not new news. As you've heard, our current healthcare system is complicated, it's inefficient, it costs too much, and it leaves many uninsured and or unable to get the care that they need. It provides inefficient, inequitable care and produces poor health outcomes. You have heard that we have the most expensive system in the world, consuming almost 18% of our gross national product. In Maine, as of 2020, the most recent data available, Maine had the 10th highest per capita health expenditures in this country. And in a survey recently conducted, nearly 70% of Mainers said they believe just one major medical event, illness, could bankrupt them. More than 1 in 3 have skipped or delayed going to the doctor when they were sick due to cost. 1 in 4 cut their pills in half. They've skipped going to the doctor. They've skipped dosages of medication or delayed or did not fill a prescription due to cost. Nearly all Mainers who were surveyed believe it is highly important that everyone in the state has access to comprehensive health insurance. The state-based Universal Health Care Act provides a solution and a framework so that all Mainers, all residents of this country have affordable, comprehensive, and equitable health care. This bill will keep residents healthy, help to provide the highest quality health care, including a focus on preventative care and early intervention, and address the imbalances in access to health care in our rural and urban areas. And it is expected to improve socioeconomic and racial disparities in access to health care. I want to tell you that Maine is ready. Maine is ready when, not if, but when this act passes. Maine is ready because in 2021, we passed Public Law 391 that set in place the Maine Healthcare Act. It means that once this passes, we will immediately put in place a plan to provide universal health care to our residents. We could not be more proud to stand here today with the senators and representatives and all of these wonderful, incredibly gifted state legislators, because I am hopeful. Today is about hope. We are hopeful that this is the time to act, that we will get this done. There's no doubt we will get this done over the line, and we will bring health care as a human right to all of our residents here in this country. I'm so proud to be here today. I want to take a moment to introduce Colorado State Representative Karen McCormick, who is next. Thank you.
Hi, everyone. I am State Representative Karen McCormick from Colorado. Thank you, Senator. Thank you, representatives, and all of my other folks from the other states. This is really exciting. We know where we're at in healthcare right now, but I want to give you a little vision of where we can go. And it took us 3 years in Colorado, but just this year we passed a bill, the governor signed it, we worked with hundreds of people in different advocacy groups across our state. We're going to instruct the University of Colorado School of Public Health to do an in-depth analysis, a study for us to know all the questions that come when you talk about a universal health care system. We want to know how a universal health care payment system will work in Colorado. And this system would cover all Coloradans. No matter who you are, no matter where you are, if you're in the state and you're a resident, you will be covered. It will have no co-pays and no deductibles. It will have premiums that are based on the ability to pay, as we all want to do. And it will establish a not-for-profit enterprise so that we are delivering health care, we're paying providers an attractive reimbursement level so that we can get providers to our state. And we want to make sure that we keep our hospital systems whole. So this sounds like nirvana, but this is what we need. We need a system that actually can exist well into the future, that's financially stable, that covers everyone. Mental health care needs, behavioral health care needs, you name it, you are covered. And this analysis is due in about 1.5 years. I'm willing to share all the information and data with all the other members of the other states so that when you have to go to your voters and have them vote something like this in, we'll have the answers to the questions that your voters have. We may not be able to pull it off as a state. We may need to have a regional approach of Western states. We may not have enough population to keep this thing going. But with this federal law, with this state-based Universal Health Care Act, we have even a better chance of getting this through, partnering with our federal government. So I am so excited about this bill. And I know it's going to be a hard fight, but I am cheering you on from Colorado. So I look forward to it being introduced and passed, and I will pass the mic over to New Hampshire Representative Crystal Lloyd. Thank you all very much.
Thank you. Thank you, representatives and congressmen. I am one of several hundred New Hampshire state representatives. Our districts are small, but what that means is that I get to know my constituents. They are my neighbors, they are my friends, they are the people I see at church every Sunday and at the grocery store in the evenings. I know about the single mom who is worried about her 3 sons and what the Republican cuts to Medicaid will mean. I know about the hospital in my district that is worried about its future. I know about many hard-working Granite Staters that are living paycheck to paycheck, working more than 40 hours a week, often at multiple jobs. They simply cannot afford $4,000 to $7,000 additional in a high-deductible health plan on top of their premiums and copays. We continue to see increase after increase in healthcare costs, while at the same time seeing a decrease in benefits and coverage. Enough. We've had enough. I have over 18 years in nonprofit experience. Our healthcare system should not be about making profits. It should be about people. This legislation moves the federal government out of the way of innovation, creating a path forward that works for our collective needs. It's a path that allows our doctors and nurses to finally focus on the jobs that they were trained to do, saving lives, rather than stuck on the phone with our insurance companies. People deserve better. I am from a small but honest and hardworking state in New England. I'm a Granite Stater, and my constituents and I are ready to see the work done to build something that all of us want. Health care that everyone can access, that won't drive us into debt or bankruptcy to get it. And now I'm handing it over to State Senator from New York, Gustavo Rivera.
Thank you, Representative. My name is Gustavo Rivera, State Senator for the 33rd District in the Bronx, Chair of the Health Committee in the Senate. And as my colleagues have said here, a lot of it has been said already. Let's just go over a couple of things, and then I'll say one thing that has not been said yet. Healthcare is a human right. We should treat it as such, and yet we have a system in which that is not the case. We have the obscenity of medical debt, which is something that can happen nowhere else in the world. But here people can go broke because they get sick. The one thing I want to underline that has not been said yet is that this is a non-partisan issue. Even though the folks that you see behind me are all Democrats, the fact is that in my district in the Bronx, the issues that are impacting somebody in a rural district upstate who would never vote for me are the same that my constituents have. They also have to deal with insurance companies that fight them more than give them care. Insurance companies that have a business model that requires for them to deny care as opposed to providing it. So the fight that we're having here, the fight that we're having from Ohio to California to Michigan to New York and every also in between is the same one. We can provide for Americans, and we can do that by creating a system that is single payer. And as it was said before, the states are the laboratories of government, aren't they? Well, we can do that in the states. We have bills in all of our states, and with this bill happening at the national level, it can just make it easier for us to be able to provide that. So I certainly thank both Representative Khanna, Jayapal, and Senator Markey, and all of my state colleagues. But again, this is a nonpartisan issue. Regardless of where you are, we can get this done, and we need to get this done for every American. And now I'll introduce Ohio State Representative Michelle Grimm. Thank you.
Thank you. I'm Michelle Grimm, and I represent Toledo in the Ohio House of Representatives. I'm proud to support State-Based Universal Care Act as the lead sponsor of Ohio House Bill 289, the Ohio Health Care Plan Act. When I served on Toledo City Council, I led an effort to make our city the first in the nation to eliminate medical debt for tens of thousands of families. I saw how one unexpected hospital bill could push someone into financial crisis, and how life-changing it was to lift that burden. Medical debt should not exist. Families shouldn't face financial ruin just because someone got sick. The Ohio Health Care Plan Act would guarantee health care for every Ohioan. No copays, no deductibles, no surprise bills. But states like ours can't do this alone. We need federal support and flexibility to make universal coverage a reality. Healthcare is a right, not a privilege. I'm proud to stand with leaders from across the country to fight for a system that puts people ahead of profits. Thank you very much, and I will now introduce the president of One Payer States, Chuck Pinocchio.
Thank you, Michelle. And this is really a dream event following a nightmare week. I've been at this work. My name is Chuck Pinocchio, president of the 25 state healthcare justice centered one payer states. We've been around since our founding in 2009. Special thanks to Representative Khanna, who has been a masterful leader on this issue, following the excellent leadership of Representative Jayapal and her great work on Medicare for All, and Ed Markey, who I know from the Peace and Justice days of the 1980s when I was at Maine. Really an honor to be with you all, as well as these wonderful state representatives. You are the pillars of the future. You are the light that really keeps me going and keeps our constituents going across our 25 state network. I just want to say something about the premise of our organization, since this is really our centerpiece legislation. We operate based on the strategic theory of change and the historical and constitutional practice of change, which is that state innovation, more times than not, leads to national reform. National reform, more often than not, follows state innovation. I think it needs to be repeated. And we're talking about political, economic, social, cultural, and yes, healthcare reform. Look at the progressive era. Look at the New Deal era, the Great Society era, and even the rise of Obamacare. Labor rights, women's rights, voting rights, and expanded healthcare rights. But insofar as healthcare is concerned, the job is far from complete. And as of last week, the attacks on Medicaid and Medicare, we are in retreat. We need to pull ourselves together and redouble our efforts in going forward. That's why the passage of the State-Based Universal Health Care Act, what Rep. Khanna calls Medicare for All through the states, stands the best chance of winning 218 votes in this Capitol, 51 Senate votes, in the 218 House votes, 51 Senate votes, and 1 presidential vote in 2029. This enabling legislation, bringing together federal health care dollars and a legal waiver requiring businesses to participate, is far more than a messaging bill, as some would maintain today. It is an education bill. It's a vision bill. It's an inspiration bill around which we are building and expanding our movement to win not only healthcare justice for all, but also health justice for all, democracy, climate, food, housing, privacy, bodily autonomy, education, and a clear path to citizenship. This is a pillar moment. This is a vital moment for us to pull together. We know what's coming at us. We're facing tyranny straight in the face. We need to pull together and to win this fight. So thank you to my colleagues. Thank you for everybody for being here today. And thank you to our constituents across the country. We are going to win. Next up is a very dear friend of mine. We've been working together for years, Wendell Potter, tremendous individual, whistleblower, somebody who is a great educator to me and keeps our eye on the ball. His journalism, his advocacy is something to marvel at. Good friend, Wendell Potter. Thank you, Wendell.
Chuck, thank you so much. It's wonderful to see this day and a tribute to you. It wouldn't happen without you and senators and members of Congress and state legislators. Thank you for this. This is important legislation that should have bipartisan support. We've heard over the years about how states can be laboratories for public policy and important change. Republicans especially have been supportive of efforts to give states more authority to experiment and to implement policies that can improve their finances and the well-being of the people who live in those states. It's important to point out that Canada's path to universal coverage began at the provincial level. Canada's state level began in Saskatchewan and was led by an effort by not a Republican, but a Baptist minister who was tenacious, Tommy Douglas, who stayed in the fight for many years and was able to get that enacted in Saskatchewan. And it took years before Ottawa paid attention, but Ottawa ultimately did, and so are the other provinces. And I think that's what we will see when this legislation is enacted and states have more flexibility to move toward a system that works for them and the citizens who live there. A friend of mine has started saying that what we need is USA coverage. USA meaning universal, simple, and affordable, and we have nothing like that in this country right now. We need to have, maybe to borrow a term from my old industry, I used to work in the insurance industry, a uniquely American healthcare system that would have those features, but they're features that every other developed country in the world has been able to achieve. A system that is universal, that is simple, and that is much more affordable than the U.S. healthcare system. So I'm proud to be a supporter of this legislation and to work with others. I think that we can build on this, bring more advocates into this work, and make it truly a bipartisan effort to achieve what we really need to achieve. Congresswoman Jayapal mentioned that we have a healthcare system that's largely driven by greed. It certainly is. I saw that up close when I worked in the insurance business. And we have got to counter that, and this is one way of doing that. Thank you all very much.
Now we're going to hear from Rob Weissman, President of Public Citizen.
Thank you all for being here, and thank you for your patience on the last one on the long list, so thanks for managing the heat. Donald Trump and the Republican Congress just stripped health care away from 17 million Americans. We know exactly what this is going to mean. It means people are going to go without care they need. They're going to skip preventative services they should get. They're going to get sick when they shouldn't get sick. They're going to stay sick longer. When they do get care, they're going to pay more. They're going to suffer from medical debt, medical bankruptcy. Many are going to go without care at all, and they're going to suffer needlessly, and some, a large number, will die. We know with mathematical certainty what that number is. It is more than 50,000 deaths every single year as a result of the reconciliation package they just jammed through Congress. They talked about waste and fraud. There is no waste and fraud among individuals. There's huge waste and fraud in the system. They didn't go after that. They didn't go after $200 billion a year for big pharma, $100 billion a year for Medicare Advantage companies. They didn't knock out $700 billion a year in waste on billing from the private insurance industry. They didn't do any of that. So, if California says, we don't want 1.4 million more people uninsured, we don't want 3,000 of our people to die every year, they should be able to adopt their own single-payer system. And what states' rights advocate is going to get in the way? If Florida says, we don't think there should be 520,000 additional uninsured in our state, we don't want 1,100 more people to die just from the Medicaid cuts alone, we want to move to a state-based system of universal health care, how can advocates of states' rights get in the way? If Kentucky says 180,000 more uninsured doesn't sound like a good idea to us, we don't want 400 deaths every year. If Massachusetts says the same thing with the same numbers, we want to move to a universal system, a universal health care system, how can state rights advocates be in the way? If Mississippi says it's not a good idea from our point of view to have 47,000 more uninsured people, we don't want 100 people more to die every year from lack of health insurance, we want to have a universal health care system, how can state rights advocates get in the way? This bill that we're here to talk about, this bill that we're here to talk about, the state-based universal health care legislation, should be supported by 435 members of the House of Representatives and all 100 members of the Senate. And we are going to fight until the day comes when at least a majority pass it in both houses. Thank you.
Beautiful. Okay, questions from anyone?
So on top of the recent federal cuts to health care, yesterday the SCOTUS okayed cuts to the Department of Education. Do Democrats have a plan to respond?
Well, first of all, Linda McMahon, the Secretary of Education, came before my committee for confirmation. I asked her in the committee, are you going to dismantle the Department of Education? And she said no. So what is happening is, without question, going to damage local communities as the funding that otherwise would be reaching cities and towns across the country are going to slow to a trickle. That is their plan. And so what we are going to do well, first of all, in the courts, because this case is not finished yet in terms of the power which this administration has in order to cut off these funds. But, and I'll let Congressman Connor speak for himself, we're just going to continue to raise these issues. We're going to put it on the front burner of the American political system for the next year and a half. And this is going to be an election that is a referendum on cuts to health care, cuts to education, cuts to environmental protections in our country. And in the appropriations process, we are going to put the Republicans on the griddle to ensure that they have to actually explicitly vote to kill this funding for education. And that process is about to unfold, the appropriations process, and they're going to have to get pretty much every Republican to sign off if this is going to be a permanent defunding of education. Yep. Okay. Yeah, good. Questions from anyone? Thank you all so much. Thank you, state representatives. Thank you. Let's do the group photo.
Yeah.
Let's get the Capitol here in the background.
Oh, yeah, sure.
Okay.